Yes, hello guys, welcome back to my YouTube channel. In today's video I'm going to talk about vitamin D tablets or capsules. Like most of you go at the pharmacy and they prescribe it for you, but you don't be knowing what you're taking them for. You don't be knowing what it does in your body. So that's the reason as to why I'm here today to talk about it in today's video. So this is the vitamin D that I'm talking about. Yeah, this is the vitamin D that I'm talking about. This is a strip that I'm using. Yeah, this is a strip that I'm using. Mine it's weighing 1000 international units, but you might find that the one you're going to get from a nearby pharmacy it will be weighing 2000 international units. It doesn't matter, it's all vitamin D. So mine is in capsule form. It's a gelatin capsule. Yeah, but still vitamin D, weighing 1000 international units, but still vitamin D. You can get the one which is in tablet form, capsule form, weighing different international units, but still vitamin D, and it's useful in your body. So functions of vitamin D. What's the function of vitamin D in our body? Vitamin D helps us in calcium absorption from small intestines, and that helps us in good skeletal health, and that improves our muscle strength, so vitamin D also helps us in absorption of phosphorus from distal small bowel, whereby it's adequate that phosphorus and calcium improves or gives us a proper mineralization of the bones, and hence giving us optimal skeletal matrix. The third point under functions of vitamin D also helps us in maturation of osteoclast. Most of you guys, or some of you guys, if you had some anatomy lessons, I think you're getting what I'm talking about if I say osteoclast. So with this vitamin D helps us in maturation of osteoclast. So I'm done with the functions for vitamin D. So in which conditions or which factors could make someone to have vitamin deficiency? Because I've just talked about what vitamin D does in our body, and I think you've seen that it's useful in our bodies. So which factors or which conditions can make someone to have vitamin deficiency in his or her body? Number one, inadequate exposure to sunlight. Inadequate exposure to sunlight makes one to have vitamin deficiency. Number two, healthy conditions. There are some healthy conditions that could make someone to have vitamin D deficiency, and some of them are short bowel syndrome and cystic fibrosis. Cystic fibrosis and short bowel syndrome makes one to have vitamin D deficiency. Third factor that could make one to have vitamin deficiency in his or her body is medication. The kind of medication you'll be taking. There are some kinds of drugs that make someone to have vitamin D deficiency in his or her body, like rifampicin, phenobarbital, and Deratin, or you can call it Deratin. Those very kinds of medication make someone to have vitamin D deficiency. So if you know that you're on those kinds of medication, or one of the medications or one of the drugs I've talked about that makes someone to have vitamin D deficiency, you can make it a habit to be having vitamin D caps or tablets intake like once in a week for yourself, so that you prevent yourself from having vitamin D deficiency in your body, because you've gotten to know or have talked about the functions of vitamin D in our body. And the last four factors that could or can make someone to have vitamin D deficiency in the body is it's about exclusive breastfeeding. Exclusive breastfeeding brings about minimal amount of vitamin D supplements in the milk, hence making a baby to have vitamin D deficiency in the body, which can bring about rickets or ball legs. So if you're doing exclusive breastfeeding, you can be supplementing or giving your baby vitamin D supplements so that you can prevent vitamin D deficiency in your baby's body or in your kid's body. So those are the four factors or the conditions that could make someone to have vitamin D deficiency in the body. And I'm going to talk about the outcomes of vitamin D deficiency in the body. One, rickets. Rickets is one of the outcomes or is one of the conditions that we normally see in kids or children as a result of vitamin D deficiency, or we can call it ball legs. And in adults, it's known as osteomalacia, or at a later age, it can be osteoporosis. So in adults, vitamin deficiency mostly manifests as osteomalacia, and those people be having or complaining about chronic muscle ache and pain due to vitamin D deficiency in their bodies. And if you're above 50 years or around 50 years, kindly be using these vitamin D supplements, because people above 50 years are at a high risk of getting hip fractures. So if you be having vitamin D supplements in your body, it reduces the risk of hip fractures. So you can be having them and promote or improve your muscle strength, keep a normal skeletal system, or have a normal skeletal system, or not, or you can be supplementing them to your kids or to your child, to your baby, so that you don't have so that you don't have to be visiting hospitals after getting those outcomes, or the outcome of rickets or ball aches when your child has experienced it, or when you as an adult you've experienced osteomalacia or osteoporosis later in your age due to vitamin D deficiency. Thanks for listening, guys, and thanks for following my channel. And if you've gotten something useful from my video, please like. You can put down your comments. If it's inquiry, I'll reply to it. You can share this video to your friends, relatives, so that they can get to know what vitamin D does or the functions of vitamin D.